Hello guys, welcome back to my YouTube channel. Today I'm going to discuss about the eighth cranial nerve, vestibulocochlear nerve. As the name says, this nerve composed of two components as cochlear nerve and vestibular nerve. The vestibulocochlear nerve carries special somatic afferent fibers from the internal ear. Actually, it is a sensory nerve. There is a unique feature about this nerve, that is the sensory ganglia related to these two nerves. It contains bipolar neurons, unlike in other nerves. Uh, about the functional components, the special somatic afferent fibers originate in the vestibular and cochlear receptors in the internal ear, and they carried in the vestibulocochlear nerve for termination on vestibular and cochlear nuclei. First, we will discuss about the vestibular nerve. The vestibular nerve carries sensations of position and movement of the head in space from the macula and cristae of the inner ear. The sensory ganglion related to this vestibular nerve is called vestibular or Scarpa's ganglion. Here you can see semicircular canals. So, here is the vestibular nerve, and here is the cochlear nerve. This is the internal acoustic meatus. So you can see these are the vestibular ganglia. You can see the vestibular nerve starting from the macula and cristae of the inner ear. Actually, this nerve begins in the vestibular ganglion. Here are the vestibular ganglion, which is located at the lateral end of the internal acoustic meatus. This is the internal acoustic meatus. This is the lateral end. The peripheral processes of bipolar neurons pass through the foramina in the lateral end of the internal acoustic meatus and supplies ampullary, cristae and maculae. The central processes of ganglion cells collect from the trunk of the vestibular nerve, and in the internal meatus, vestibular nerve is in close relation with the cochlear nerve and the facial nerve as well as the labyrinthine vessels. When we talk about the course through the posterior cranial fossa, the vestibular nerve enters the posterior cranial fossa and passes through the cerebellopontine angle to reach the brainstem. This is a diagram of cerebellopontine angle. Here is the cerebellum. You can see the brainstem, the midbrain, pons, and medulla oblongata. So this area is the cerebellopontine angle, and you can see vestibulocochlear nerve here. This is the vestibulocochlear nerve. Then this vestibular nerve enters into the brainstem through the pontomedullary junction. This is the pontomedullary junction, pons and the medulla oblongata. So this is the pontomedullary junction, slightly lateral and posterior to the facial nerve. Because this is a sensory nerve, we have to talk about the nuclei of termination. Actually, the vestibular nuclear complex consists of superior, inferior, as well as lateral and medial subdivisions. You can see those nuclei subdivisions here in this diagram. This is the medulla oblongata cross section, and this is the medial, then superior, inferior, as well as lateral nuclei of the vestibular nerve. Then these multipolar neurons are second order neurons in the vestibular pathway. The vestibular nuclei occupy vestibular area in the lateral part of the floor of the fourth ventricle. Therefore, they are seen in the lower part of the pons and upper part of the medulla oblongata. These nuclei receives vestibular nerve, cerebellovestibular fibers from the flocculus and nodule, spino-vestibular fibers and reticulovestibular fibers. There are some efferent connections to these vestibular nuclei as well. I will tell you that briefly, no need to by heart them. And the vestibular nuclei are connected to archicerebellum. The medial longitudinal bundle connects it to the motor nuclei of third, fourth, and sixth cranial nerves. Remember that the medial longitudinal bundle connects this vestibular nuclei to third, fourth, and sixth cranial nerves. It is through these connections that vestibular-ocular reflexes are mediated. That means because of these connections through medial longitudinal bundle, that means the connections of the third, fourth, sixth, and eighth cranial nerves, there is vestibulo-ocular reflexes. Then the anterior horn cells of cervical spinal cord receives vestibular inputs from medial vestibular nucleus and via medial longitudinal fasciculus for coordination of head, neck, and eye muscles. Then vestibulospinal tracts contain fibers from ipsilateral vestibular nucleus for anterior horn cells of the entire spinal cord. This connection is responsible for extensor muscle tone in anti-gravity muscles required for maintaining upright posture. Those are the four efferent connections of vestibular nuclei. Then the cochlear nerve. Here you can see both nerves together. From this area, you can see how the vestibular nerve is started, and from this area, from the cochlear or spiral ganglions, you can see how the cochlear nerve is started. So the cochlear nerve carries the sound impulses to the cochlear nuclei in the brainstem, from where central auditory pathway carries impulses to auditory cortex. This pathway is unique in having more than 3 neurons in its course: bipolar cells, then cochlear nuclei, then superior olivary nucleus, as well as the medial geniculate body. When we talk about the origin and intrapetrous cause of the cochlear nerve, the peripheral processes of bipolar neurons of spiral ganglion innervates the hair cells in the organ of Corti. The spiral ganglion is located in the spiral canal in the modulus, and then the bipolar neurons are the first order neurons of the auditory pathway. Then the central processes of the bipolar neurons pass through the tractus spiralis foraminosus at the medial end of the internal acoustic meatus. Then the cause in the posterior cranial fossa, the cochlear nerve passes through the pontocerebellar angle to reach the lateral aspect of the pontomedullary junction. It enters the pons and divides into ascending and descending fibers, which terminates in the ventral and dorsal nuclei in the floor of the fourth ventricle. Here, this is the ventral or anterior cochlear nuclei, and this is the posterior or dorsal cochlear nuclei. So this, you can see those fibers in the cochlear nerve terminates in the anterior and posterior cochlear nuclei. We have to know the auditory pathway. So from this picture we will learn about the auditory pathway. A large number of axons from ventral cochlear nuclei dissociate with those of the other side to give rise to the trapezoid body in the lower pons. Here you can see the ventral cochlear nucleus, and here the red fibers going towards this superior olivary complex here. Then here you can see how the fibers coming from the ventral cochlear nucleus dissociates to the other side, in forming the trapezoid body in the lower pons. Here is the lower pons area. So in this area is the trapezoid body. The trapezoid body has some scattered nuclei where a few axons relay. Others terminate in the contralateral superior olivary nuclei for relay. This is the contralateral superior olivary nucleus. Here the ipsilateral superior olivary nucleus. Then a few other axons that do not relay in the superior olivary nuclei do so in the nuclei of the lateral lemniscus. Here is the lateral lemniscus. In this area you can see the lateral lemniscus, and here is the nucleus of lateral lemniscus in this area. So some other fibers rely on the nucleus of lateral lemniscus. The uncrossed axon synapse in ipsilateral superior salivary nuclei as here, and then ascends in the lateral lemniscus of the same side as here. Some axons from the ventral cochlear neurons pass dorsally to reach the opposite side as intermediate acoustic striae. In their further course, they probably join the contralateral lateral lemniscus as well. The axons from dorsal cochlear nucleus turn dorsomedially across the midline and dorsal acoustic striae. Here is the intermediate acoustic striae. Here the blue fibers are the intermediate acoustic striae, and here the green fibers are the dorsal acoustic striae. You can see the intermediate acoustic striae and dorsal acoustic striae ascends in the contralateral lateral lemniscus. They ascends in the contralateral lateral lemniscus and probably relay in the nuclei of lateral lemniscus. Here, the neurons of the superior olivary complex, trapezoid nuclei, lateral lemniscus nuclei, and some neurons of the inferior colliculus are regarded as third order neurons in the auditory pathway. So, what are the third order neurons in the auditory pathway? The neurons of the superior olivary complex, the neurons of the trapezoid nuclei, then lateral lemniscus nuclei, and some neurons of the inferior colliculus are considered as the third order neurons in the auditory pathway. This lateral lemniscus, actually this is fiber tract, is the main ascending tract of the auditory pathway. It extends from the superior olivary complex nucleus to the inferior colliculus. So this area is the lateral lemniscus. It is composed of both crossed and uncrossed fibers, which belongs to second and third order neurons. It is connected to contralateral lemniscus via commissural fibers through which it receives fibers from the contralateral superior olivary nuclei. This inferior colliculus receives auditory input from lateral lemniscus. It is also connected to opposite colliculus. Both relayed and non-relayed fibers projected to medial geniculate body here. Here the medial geniculate body in the thalamus, and the structural arrangement of neurons suggests tonotopic organization between neuronal layers and cochlear turns. Actually, this medial geniculate body is a part of metathalamus. The neurons show laminar organization. The brachium of inferior colliculus ends in the medial geniculate body, which is the highest order neuron to project the auditory cortex. The higher frequency sound impulses are received medially, and low frequency impulses receive more laterally in the medial geniculate body. Then the auditory radiation. The auditory radiation is composed of axons of neurons of the medial geniculate body. It passes through the sublentiform nucleus of internal capsule to reach the auditory cortex. And here is the auditory cortex in both sides, and this auditory area, primary auditory area, is located on the superior part of the superior temporal gyrus. Here is the superior temporal gyrus. Actually, it is in the superior part of the superior temporal gyrus. The areas are 41 and 42 Brodmann areas, and it projects to the auditory association area or area 22 on lateral aspect of the superior temporal gyrus as well. The auditory area receives impulses from both cochleae. Therefore, lesion in the auditory cortex of one side will not cause hearing loss. You can see this auditory cortex has received fibers from the both side. Therefore, if there is a lesion in one side, it will not cause hearing loss. Let's discuss what happens if there is a lesion in vestibular nerve. So, a lesion of vestibular nerve results in disequilibrium, vertigo, and nystagmus. The vertigo is a feeling of giddiness with a sensation of rotation of head that may occur due to excessive stimulation of semicircular canals. And also, vertigo can be associated with nystagmus. Nystagmus means there may be involuntary and incoordinated eye movements which we can see. So that's all about what I have to discuss this vestibulocochlear nerve. So if you like this video, please put a like and a comment in the comment section, as well as subscribe into my channel for more videos, and thank you for watching.